Welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. You might wonder to yourself sometime, how can anyone be a food addict? What is a food addict? We all have to eat, right? Are we all addicted to food? Even though I might sometimes overeat, I don't consider myself a food addict. Maybe you don't, or maybe you do. Our guest is Jamie, and she's here to talk today about Food Addicts in Recovery Anonymous, or FA. She's going to talk about her journey as a food addict, what a food addict is and is not, the FA book, and what healthcare professionals are just beginning to learn about food addiction. Welcome to Health Professional Radio, Jamie.
Thank you.
A food addict. I've heard of Alcoholics Anonymous, Narcotics Anonymous. As I said, we all have to eat. If I overeat, does that qualify me as a food addict? Tell me what a food addict is.
Well, I can tell you what I am as a food addict, and okay. I think that is somebody very similar to an alcoholic, somebody who knows perhaps with good judgment that they are eating too much, wants to not eat it, and makes the decision to eat it anyway, trying to stop and not being able to. For me, I know that I wanted nothing more than to lose weight, but I chose to eat, knowing that was destructive and that I was not going to get the results I wanted, and I chose it anyway, almost like a drug.
When you say you use food like a drug, are we talking euphoric feelings or maybe energetic? How did it affect you? I know when I'm hungry, I eat some food, it feels great.
Mm-hmm. That's normal. Mm-hmm. What I would do was I would use it when I had a feeling that I didn't want to feel. Mm-hmm. And it was almost unconscious. I would eat when I was feeling nervous, when I was fearful, when I was angry, and sometimes when I was joyous. And all those times, I knew I didn't really want to eat that food because it wasn't necessarily nutritious. It wasn't necessarily something that was going to give me what I needed in terms of nutrition, but it was something that was going to make me feel good in that moment. And I put off what I wanted most for what I wanted in that moment, which was to not feel my feelings.
You know, I mentioned AA and Narcotics Anonymous. How closely is Food Addicts in Recovery Anonymous associated or based on some of the principles and practices of those two organizations? Or how different are they? Because both of those, I do believe, deal with things that we can do without, alcohol or drugs of some type. When we're talking about food, can those same principles apply with something that we have to have?
Well, it's very, very similar to the 12 steps of AA. Mm-hmm. And it's based on the program of Alcoholics Anonymous. But with food, since we do have to come to our, drug, putting quotes around that, at least 3 times a day, we have to have a program that is a little bit more rigorous. And we have a definition of abstinence that, with alcohol, you don't have alcohol. With our program, we don't have flour or sugar because we found those to be very addictive substances, and there's a lot of literature that backs that up. Mm-hmm. And the medical community, I think, is discovering that. But those two substances, when I put them in my body, I get cravings that seem to be uncontrollable, and then I want more. So I abstain from those, and I weigh and measure my food so that I don't have too much. I have just enough for my body to maintain my 42-pound weight loss. I've maintained that for about 17 years.
Wow, 17 years. That's amazing. That's outstanding. Congratulations for someone trying to do what you're doing and actually maintaining it, because I hear so much about people losing weight and gaining it back repeatedly throughout many, many years. 17 years is quite an accomplishment. Now, I know that there's the AA Big Book. You have a book as well, the FA book. Talk about this book and how has it helped you in your journey?
Well, this book, we published it about 3 or 4 years ago, maybe a little bit longer, but it's a wonderful book because it does explain to somebody who's considering whether they have an addiction problem with food, what it is. And then we have stories, just like the AA Big Book. We have stories in our book of people who have gone through food addiction and their recovery and their, the solutions that they've found. So anybody with any coming from any direction, there, we have people who are bulimics, people who do exercise too much, people are coming from underweight, people from overweight. And so there's a story for everybody in there. And the book is available on our website, which is foodaddicts.org. Mm-hmm. And it's a very comprehensive book. It's very well written, very easy to read. And I found it very, very helpful. I didn't have it at the beginning of my recovery. And so I relied, and still do rely on reading AA's big book, their Alcoholics Anonymous book.
How much does your behavior, how important is it in maintaining abstinence from food? In AA or NA, focus on the behaviors that go along with the addiction. Do you have sponsors that kind of you're accountable to for not only abstaining from food, but some of the other behaviors that may go along with the feelings that you said you were trying to escape?
Yes, we do. We have tremendous support in this program. Everybody has a sponsor. And I, at the beginning of my abstinence and program, I called my sponsor for 15 minutes every day, and I had her to speak to about anything that I wanted to. And at the beginning, it was hard to speak about anything except for the food, and to open up and realize that some of my addiction was really caused by feelings. I couldn't even address that at the beginning. I just thought I had a diet problem. I didn't realize that I had a life problem. And I had somebody who helps me, who's completely objective, isn't my family member, and who I can hear because they are not as involved in my life as my family, and I don't have to pay them. And they give me free advice and help me with my feelings, help me work through the 12 steps of our recovery, and I get tremendous support every day. Now I don't call my sponsor as frequently, but she's available anytime I need to speak about something. If I have an issue with one of my children or my husband, or a situation in my community or something, or a feeling that I have. It's, from the mundane to the very, very concerning issues, I have somebody to speak to.
As far as healthcare professionals who specialize in dietary issues, weight gain issues, weight loss issues, diabetes, and some of the related issues that go along with, food abuse, is that an appropriate phrase?
Yeah, I think it is.
Okay, then
yeah.
As far as some of these healthcare professionals who specialize in that sort of thing, what have you found what kinds of lights are going off in their minds, as opposed to maybe how they approached this issue several years ago, 17 years ago?
Well, it's funny. My father was a doctor, and he was always telling me things like, just cut out this, or don't eat sweets, or just don't eat that, or whatever. And I think he kind of grasped the idea of food addiction, but he didn't really know about it. And I think that there's a lot of new literature coming out about the addictive qualities of flour and sugar. Flour turns into sugar once it gets into your body. And sugar has an addictive quality. It does something to the brain function and everything. I can't explain it because I'm not a medical professional, but I've been reading articles over the last 5 years that really point to that. And I think that it's so easy for a doctor to just say, here, here's a pill to take, or here's a diet to follow. But if they don't really understand addiction and the underlying causes and physiological responses that people have, then there's just palliative measures that don't really do anything.
Once again, as we wrap up, Jamie, give us that website where we can go and get a copy of the FA book.
Okay. It's foodaddicts.org.
Foodaddicts.org. I appreciate your time and coming in and speaking with us today. Jamie, Food Addicts in Recovery Anonymous, or FA. It's been a pleasure. And good luck and congratulations and continued success.
Thank you, Neal. Thank you very much. All right. So long.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Jamie of Food Addicts in Recovery Anonymous. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.